Good evening, everyone. Welcome to the October 21st meeting of the DeForest Park Neighborhood Group, Neighborhood Association. We normally start with a flag salute with a little proviso here. We are recording, we reserve all rights to that. So we are copyrighted, etc. We are also a 501c3. So Ryan, let's start with the flag salute. Oh, let me read it. Any person or organization not affiliated with DeForest Park may not copy, alter, modify, use DPNA photographs, graphics, videography, or other similar reproductions without the advance permission of the authorized designee from DPNA, which is us. Okay, Ryan, let's start with the flag salute.
I pledge allegiance
to the flag
of the United States
of America
and to the republic
for which it stands,
one nation,
under God,
indivisible,
with liberty
and justice
for all.
Okay. And I don't see anyone from the North Division. So Ryan, do we have crime stats?
No, not for this month. We don't. I didn't have a chance to pull them.
Okay, not a problem. We will catch up next month. Let's move on. I don't see anybody from the 9th district yet.
Nope.
No one from the 8th district?
Nope.
Wow. I hate to say it, we're getting close to Christmas. It's Silent Night. Pretty interesting. I know today they did some things over at Ramona Park, but without them being here, I don't know what exactly to say. So we will move on with the meeting. We will go ahead and go directly to Dr. Davis, and you're welcome. We'll just catch up with the others later. Oh, hi, Georgia.
Hi.
Okay, hold on one second, Dr. Davis. How about an update on the opening, the groundbreaking at DeForest Park?
Oh, sure. It was great. Lots of folks there. A great program that followed the actual groundbreaking. I don't know, it just felt friendly and energetic, and there was a lot of excitement there that day. A lot of people from around the city were there. Mark Stanley from the Rivers and Mountains Conservancy was there with Joseph Gonzalez from his staff, and so it was just a lovely afternoon. It really was.
Great.
So we're off and running.
Any new programs or anything happening with Campfire?
No, I will tell you. So that was the good news. The only thing that's complicated right now, and it's not that we didn't think of it, but it's been a little bit complicated. Occasionally, the water has had to be turned off and/or the electricity, which we didn't think about. In terms of, we always thought there would be some notice, and a couple of times we've had little issues with that. So we're working on that together. Some of it was just miscommunication right in the beginning, actually with the contractor, not with either CCLB or us. So it's going to be fine. But yes, that was a little surprise, and we ended up having to be closed for about a week ago.
Okay.
Just because of that. But I anticipate that may happen from time to time, but we're hanging in there and excited that this is, I think, going to be a real benefit to the neighborhood.
Thank you very much.
You're welcome.
Just another little update. This one has to do a little bit further up the block, and there was a park dedication right next door, and that was on the at the end of last month, and it turned out pretty good. We had very close to, according to the head count we had about 87 people there, that
Oh.
showed up. So that was a big crowd to watch us pull the cord on the Pressburg Parkway. So that was very, very good. A lot of people enjoyed. We had a lot of people over for afterwards, and we actually had tacos prepared directly in the yard, so there was no COVID problems. Everybody was wearing their masks, so it was pretty. It was a great day. So
Nice.
now, other than that, I don't see anyone else. I don't see the 8th or the 9th district.
Assemblymember Gibson's office is here. If they want to give.
Okay, let's put them on. I know we're not going directly by what we've got, but we're close. So let's go ahead and put them on.
Hi, can you hear me?
Yep.
Yeah, we've got you, Brian.
Oh, perfect. Thank you for having me. In terms of updates, so we've had the assemblyman was successful in having all 5 of his bills signed by the governor. There's actually a list of vetoed bills available online. I can send that to you if you're interested in. But nonetheless, we're really excited that we had 5 bills, all 5 bills signed. Right now, we're in the exploratory phase of upcoming bills for the next session. So if you want to meet with any of our legislative staff, myself, or anybody just to discuss policy at the state level, please feel free to reach out. We'd be more than happy to cooperate and, have some policy going. Beyond that, let's see. So I recently connected with Caltrans. I went to the Star King Neighborhood Association cleanup a few days ago, and they referenced that a lot of the issues that not just them, but a lot of the neighborhood associations have issues with connecting with Caltrans and doing some cleanups around the freeways. So if there's ever a need for support to connect with someone in Caltrans, please feel free to reach out. I'm local to the area, so once in a while I'll see that there is a need to clean up. So I'm more than happy to support on that front. And finally, we are also hosting a vaccination event on the 30th, so in a couple of days in Wilmington.
Hello.
Oh, sorry, go ahead.
Hang on, my phone's acting up.
Oh, no worries.
Sorry, Ray. Okay.
Okay, yeah.
Go ahead, Brian.
Yeah, so we're hosting a door-to-door vaccine event on the 30th. It's in Wilmington. However, we're slowly making our way through the district. And the reason being is because one of the things we noticed during COVID is a lot of the communities most impacted by the COVID pandemic were, again, communities of color or low-income communities as well. So given that our past event was in Watts, we had another one in Wilmington because it is a highly, most of the residents there are people of color as well. So I'll be posting the link in the chat. If any of you are available to volunteer, we would love that. If any of you would also like to receive, I send out a weekly newsletter just with local events and local information for the North Long Beach area. Please feel free to also send me a DM or reach out to me or email me. I'm more than happy to assist. But if any of you have any questions, please feel free to ask. And yeah, that's my update. Thank you.
Okay. Thank you, Brian. And now, without further ado, I know we've delayed you for 2 speakers already. Dr. Davis, you are on.
Thank you. All right. So I'm going to take over sharing the screen.
Yep.
You guys are able to hear me?
Yes, we are.
Okay, great. Let me just make sure this is the right. Yes. Okay. So thank you for having me. I'm Mrna Davis, the City Health Officer for the City of Long Beach Department of Health and Human Services. I am a North Long Beach resident in the Collins area neighborhood. So the topics that I'll be going over today are COVID-19 statistics in Long Beach, the vaccination rates in Long Beach, some information about the Delta variant, reviewing kind of vaccines in general, vaccination and testing locations in Long Beach, and then just very briefly touch on the Dominguez channel. That really is an LA County, response, or it's in their jurisdiction, but we'll kind of touch on it a little bit. Feel free to put questions in the chat as we're going along, and then I think we're doing Q&A at the end as well, if I'm not mistaken. So just to go over some stats of where we are in Long Beach right now. So as of the 19th of October, we've had 64,763 confirmed cases of COVID-19 among Long Beach residents. We currently have 51 Long Beach residents hospitalized, and there's 40 people in area hospitals. So that includes Long Beach and then Lakewood and Los Alamitos, who have been hospitalized, who are currently hospitalized with COVID. We've had 1,033 deaths in total since the pandemic began, and 62,000 people have recovered. So currently our case rate is 10.5 cases per 100,000 population. And basically the CDC has a tier system where they put you at high, substantial, moderate, or low. And our current case rate of 10.5 and our test positivity of 1.8% puts us in the substantial community transmission. So the third highest tier, just right below high. But that is an improvement. We were in the high tier not that long ago. We hit a peak of our current surge. So we've been in a surge since June. And we hit the peak of that current surge in mid-August. And so that's what you can see on this, this graph right here. You can see the latest surge is the furthest over to the right. And you can see that we hit our peak in mid-August, and we've slowly been decreasing since then. But you'll notice that we are not back to where we were before this surge started. So before the surge started, we were really, really low. And right now we're still, we still have substantial number of cases, unfortunately, but it is better. So just to go over cases, hospitalizations, and deaths among vaccinated people versus unvaccinated people, because that comes up a lot. So in the left-hand side here, this is cases, case rates among people who are unvaccinated is this dark solid green line. And then among people who are vaccinated, fully vaccinated, are those in the dotted green line. So you can see that there's the vast majority of people who are getting infected with COVID are unvaccinated. And then hospitalizations is over here on the right. And the solid blue line is hospitalizations among unvaccinated people, and the dotted blue line is vaccinations, hospitalizations among vaccinated people. And again, you see that big difference between your risk of being hospitalized if you're fully vaccinated versus if you're unvaccinated. So there's a 7-fold increase, and this is data for Long Beach specifically. And there's a 7-fold increase in the case rate among unvaccinated or partially vaccinated people compared to those who are fully vaccinated. And 87% of the deaths since March have been among unvaccinated people. So just kind of highlighting the importance of vaccination to preventing hospitalizations and deaths. This is looking at the COVID case rate by age. So these are all different ages. So light blue is the youngest, 0 to 4 years of age. And then dark blue is 5 to 17-year-olds. Gold is 18 to 49-year-olds. Gray is 50 to 64-year-olds. And then red is greater than 65. And so you can see if you look over here, because this is where we are now in the October range, you can see that 5 to 17-year-olds are kind of, the highest rate of cases right now. And that really is because they are getting tested much more right now because of being in school. So LAUSD tests approximately 10% of their population each week, and then also athletes need to be tested. So that's a part of why you're seeing this spike among the dark blue, which is the 5 to 17-year-olds. And then next has really been the 18 to 49-year-olds who have been kind of the highest, kind of the driver of the pandemic, if you will, kind of have always had the highest case rates since the pandemic started. So that's the gold line. And this just gives us some data about the relative risk of being infected or being hospitalized or dying of COVID by different races and ethnicities. So basically, this is all being compared to the white population. So for Native Hawaiian or other Pacific Islanders, which is Samoans and Tongans, this 4.2 means that they have a fourfold increase, a fourfold higher case rate than the white population of cases, a ninefold higher hospitalization rate compared to the white population, then a sevenfold increased death rate compared to the white population. This has been seen in the Native Hawaiian and Pacific Islander population throughout the nation. I think that it's ongoing to try to figure out what variables are causing such a high disparity. But among all people of color, you can see on this chart, have higher risks of, or higher case rates, higher rates of cases, hospitalizations, and deaths compared to the white population. So part of the reason why we're having the surge that we're having right now is because the Delta variant kind of came on into the scene around kind of June, really took off and was the predominant type of the virus. And the issue with the Delta variant is that it's much more contagious than the original COVID that came out in December of 2019. So the original SARS-CoV-2 virus, which is the name of the virus that causes COVID-19, one person would be expected to infect 2 to 2.5 other people. Then the Alpha variant, which is that variant that came out from the United Kingdom, like around last winter, that person could infect 4 to 5 people. So that was already more contagious. And then the Delta variant, which came out in the late spring and then really took off in the United States in the early summer, one person can infect 5 to 8 other people. So you can see that it's just becoming more and more contagious as these variants kind of mutate. So just some other things about the Delta variant. So it spreads more than twice as easily. It does, fully vaccinated people who are infected with the Delta variant can infect other people. High vaccination coverage will reduce the spread of the virus and help prevent new variants from emerging. Because basically how a variant emerges is that it gets into your body and it divides, and then as it's dividing, it mutates, and then that new mutation is what might make it stronger. And so then that's how you get a new variant. So if we can keep it from infecting people and dividing, then we keep it from mutating. And as overall cases increase and as more people are vaccinated, we do expect to see more breakthrough cases, which we are seeing breakthrough cases. The good news is that the COVID-19 vaccines continue to be effective. We'll talk about boosters in a little bit. Most breakthrough infections are mild, and COVID-19 vaccines prevent severe illness, hospitalizations, and deaths, especially and from Delta as well. So some vaccine data for Long Beach residents as of October 19th. 313,441 Long Beach residents have received at least one dose of vaccine, and 80.8% of adults have received at least one dose. And 71.9% of adults are fully vaccinated in the city of Long Beach, which is great. This over here in the lower left just shows vaccinated residents by age. You can see that the elderly are the highest vaccinated rate, which is good because definitely severe outcomes, kind of the number one risk factor for having a severe outcome from COVID, either hospitalization or dying, is age. That's the number one thing, and it just kind of goes up as you get older. And then you can see that the vaccination rates kind of go down as you get younger. And 18 to 34, which I had shown is really, where all the cases are coming from, we have a 61% vaccination rate. So there's definitely room for improvement there. And then over here on the lower right is vaccination rate by race and ethnicity. And so you can see that the white population and the Asian population have the highest fully vaccinated rates in Long Beach at about 66%. And Pacific Islanders have even higher, sorry, at 73%, which is reassuring because they also had more of the hospitalizations and deaths. And then it's whites and Asians, and then Hispanic, Latino, and then African Americans are 46% of African Americans have been fully vaccinated. So also some room to improve with populations of color and vaccination. So just to kind of reiterate, so the 3 vaccines are safe and effective at preventing severe disease. They're greater than 80% effective at preventing infection, but where they really shine is that they're greater than 90% effective at preventing hospitalization and death. Vaccine protection may wane a little bit as time goes on. So boosters have been recommended, and we'll go over kind of, what the booster schedule is. The most important thing is to get your primary series, like just get vaccinated. And then definitely, yes, boosters are important. But it's really important that we get the amount of virus down in our community. And so we need more people just to get the basic vaccination. So just a summary of the vaccines. All of the vaccines work to reduce infections, hospitalizations, and deaths. And we are seeing cases in fully vaccinated people. And that's for 2 reasons, basically because so much of our population, right, 70% of our population is fully vaccinated. And there's a lot of virus that's still out there. So if you have a lot of virus and you just keep, hitting a fully vaccinated person over and over and over and over again, there is a likelihood, there is a chance, there's an increased chance because there's so much virus that you're going to be able to break through and have a breakthrough infection. And the vaccine is not 100% effective at preventing infections. Its real protection comes around hospitalizations and deaths. So this is just a summary of all the vaccines. So Pfizer and Moderna are both mRNA vaccines. So they're just a little part of the mRNA of the virus that then is put in like a carrying particle. And that's what the vaccine is. It's not the entire virus. It's just like a little part, and it's manufactured in a lab. And the dose of Pfizer is 2 doses, 21 days apart. The very rare adverse events that can happen from the Pfizer and the Moderna are that you can get severe allergic reactions. And so we do screen people out who've had severe allergic reactions to any of the ingredients in the vaccine. And then also rarely there is a risk of heart inflammation. So there's a lining around your heart and a little bit of the muscle in your heart that can become temporarily inflamed, especially in young men is where we're seeing it the most, in the like 18 to 39-year-olds after an mRNA vaccine. It's usually, you may have like a little bit of chest pain. Most people do get hospitalized just because it is chest pain. You may stay in the hospital 0 to 1 days, and then it usually will go away. You don't need treatment, but those are the things to pay attention to, and it is very rare. And then for the mRNA vaccines, if you are immunocompromised, so if you're undergoing cancer treatment, if you have kidney failure, severe liver disease, things that really make you immunocompromised, you're on certain medications that depress your immune system, like you've had an organ transplant, then it is recommended to get a 3rd dose as a part of the beginning of the primary series. So it's recommended that if you're immunocompromised, what they saw was that there's a chance that the 2 doses don't work. They don't give you that immune response. And so they're like, let's try one more time and give you a 3rd dose. So that's just for the mRNAs, for the Pfizer and the Mrna vaccines. Then on top of that, separate from that is a booster. So that actually just got approved. So the Pfizer one was approved a little bit ago, but the Mrna was just approved today, actually. And so for high-risk individuals, such as those who are older than 65, or who are at high risk to have severe outcomes, so those racial and ethnic groups that we talked about that have a higher risk of hospitalization and death, people with medical conditions, they're recommended to get a booster. So for Pfizer and Moderna, it's recommended to get 6 months after you finish your primary series, so after you finish your 2 doses. We are doing Pfizer already, and Moderna should be starting very soon, probably this weekend. Then Johnson & Johnson is different in many ways. So it is not an mRNA vaccine. It is, they take a disabled, basically a cold virus that they disable, so it cannot infect you and give you any kind of symptoms of anything. And then they stick that same little particle of the part of the manufactured part of the virus, and then that's what the vaccine is. The very rare but adverse events of that vaccine can be that there's this, you can get blood clots along with low blood, the things that you need to help you clot your blood. And this happens mostly in younger women. So kind of, 30s and 40s-year-old women. And then Guillain-Barré, which is a something that has been seen with other like viruses as well, where you have this kind of temporary loss of feeling, like a paralysis that you can have that might go like to your legs, or might go all the way up. Again, is very temporary and is very rare. The Johnson & Johnson vaccine is a 1-dose vaccine. It also was approved today for a booster 2 months after the first dose, for everyone who's greater than 18. So they don't have all those risk categories and all that. They're just like, if you're greater than 18 and you got 1 dose of Johnson & Johnson, then you should get another dose 2 months later. The other thing that was passed today or approved today is what is being called mix and match. So just because you got your Pfizer vaccine, or just because you got Moderna, or just because you got Johnson & Johnson, like whatever it was you started with, for your booster, you can actually pick any of them. So you can start with Moderna and then have Pfizer. You can have Johnson & Johnson and then have your booster be Moderna. So you don't have to stay necessarily with the same brand that you started with. There's nothing wrong with staying with the first brand that you started with. What they saw was that no matter what you started with and then what you boosted with, you at least did the same as you would have if you stayed with what you started with, if that makes sense. So if you started with Moderna and you got a Moderna booster, you do fine, you do great. If you started with Moderna and you get a Johnson & Johnson booster, you do at least as good as if you would have stayed with Moderna. So, so just to, for you to know that, that's another part of all of this as well. So this is the COVID booster, just kind of reiterating what I just already said. The Moderna booster shot is a half dose. So it's not, so the Pfizer shot is just another same dose Pfizer shot. The Johnson & Johnson shot is the same dose as the first one. The Moderna is a half dose. And then these are some locations of where you can get vaccinated. So I put the link down here. I would just, look up our website. You can also call 562-570-INFO, INFO 4636, and they can also help you guide you to where you can get vaccinated. But there's Long Beach City College, both campuses. There's evenings, there's weekends, there's Houghton Park. These are specifically Pfizer booster clinics. We'll be posting the Moderna and Johnson & Johnson booster clinics as well, but you can go to where to where they're giving out just the regular vaccines and you can get a booster, or you will have specific booster clinics on top of the regular vaccination clinics, if that makes sense. So some clinics will be just booster clinics, or you could get your booster at the regular clinic where we're doing all the vaccines for everybody. The other thing that will be happening soon is we expect the vaccinations to be approved for the 5 to 11-year-olds. So they start meeting about that on October 26th, so next Tuesday. And I think the thought is by early November that there will be authorization and approval to start vaccinating 5 to 11-year-olds with Pfizer. And the city will be doing that. We will be doing that at our mass vaccination clinics. And then in addition to our mass vaccination clinics, you can get boosters at pharmacies as well. So numerous pharmacies throughout the city are also giving boosters. And then some healthcare providers are also giving boosters as well. So there should be no issue with vaccine availability for adults or kids. So just to go over testing, the free testing in Long Beach. So appointments are preferred, but you don't have to make one. And again, I just kind of listed all the different places where you can get testing, free testing done. And when we do COVID testing, we automatically test for flu as well. And everybody should make sure they get their flu vaccine as well. We will be offering flu vaccine at our vaccination clinics by request. So you have to ask for it, but we do have it. And so this is just a continuation, Cal State Long Beach, Houghton, Cabrillo. So I'm just going to kind of go over, just review quickly the state and local orders. So just right now for the city of Long Beach, this is what's required. So all individuals are required to wear a face covering while in indoor public settings. Healthcare workers are required to be vaccinated with medical and religious exemptions. That's a state order. Visitors to acute care hospitals or skilled nursing facilities must provide proof of vaccination or a negative test. Public and private school staff must verify their vaccination status and undergo weekly testing if they're unvaccinated. That's a state order as well. Participants of indoor events of greater than 1,000 individuals must provide proof of vaccination or a negative test prior to entrance. And then participants of outdoor ticketed or defined events of greater than 10,000 are required to provide proof of vaccination or a negative test prior to entrance and required to wear a face covering. That's an LA County and City of Long Beach health order. Patrons and employees of bars, breweries, wineries, and lounges are required to provide proof of vaccination prior to entry, and restaurants are strongly recommended to reserve indoor seating for vaccinated individuals. That's also an LA County and City of Long Beach health order. City, county, state, and federal employees are required to provide proof of vaccination or test regularly. Athletes over the age of 12 participating in certain high-risk sports are required to undergo regular screening testing. These are sports like soccer, football, and basketball are some examples. Students will be required to be vaccinated after the vaccine has full approval. So that's a state order. Governor Newsom put that in place. So once the vaccine is fully approved, which will take a while, so we don't expect this to kick in until next summer, but after it's fully approved, then students will be required to be vaccinated. It'll start with the 7th to 12th graders, and then the K through 6th graders. And then I was just going to end on the Dominguez channel odor issue. So the odor began in the beginning of October. The Dominguez channel and kind of the activity and the response is under the jurisdiction of Los Angeles County. And there's various Los Angeles County departments, as well as the Southern Southern California Air Quality District, who are working to address the source of the odor. County officials believe that the source of the odor is drying, decaying organic matter at low tide. That is, as it's drying and decaying, is releasing hydrogen sulfide into the air. Hydrogen sulfide levels near the site can cause irritation, headaches, and nausea, but they don't present long-term health hazards. Those near the Dominguez Channel are encouraged to avoid prolonged outdoor activities between the hours of 9 p.m. and 8 a.m. Based on observed air quality patterns. They are noticing that that is when the air quality seems to be the worst, as well as any time odors are particularly strong. The city of Long Beach has written to state and federal partners expressing their concerns, and Los Angeles County is offering housing vouchers and air purifiers to affected homes. So that ends my presentation, and let's see. I'm just going to go through the questions here. There's talk of using a different. Oh, did you want me to just go ahead and go through the chat questions, Ryan?
Sure, go, please do.
Okay.
Just-
Okay. We're doing okay. And okay, so there's talk of using a different type of vaccine for the booster than your original. Is there a recommendation of which to use based on what you've got? That's a great question. Right now, there is not a recommendation of which to use based on what you got. So what got passed today is that you are allowed, it's okay to get one that's different than what you got to start with. The next step is that the CDC needs to put out some guidance, which they plan to do, my understanding is next week, where they will help to guide individuals maybe on which one might be the right one for you. And can I go back to, let's see, am I able, why can't I go back to my, uh-oh, I was gonna, hang on, let's stop the shared window. I was gonna go back to the slide, because what I think is going to end up happening, it hasn't happened yet, but what I think is going to happen is they're going to look at the side effects. So, oops, so like we were saying, the heart inflammation tends to be in young men. So it could be that the recommendations might be if you're a young man and maybe you have like a history of, you know, something that, you know, we're like, maybe we just stay away from this, even though it is really rare. Like I want to say it happens 7 to 8 times per 1 million doses given. So it is really rare, but it does happen. Then maybe we would guide that person to get a Johnson & Johnson. And then maybe if you're a young woman, we might guide you to get a Moderna. So I'm just hypothesizing. I don't know how they're going to come up with their recommendations, but I'm wondering if this might be a part of it. The person, one of the doctors who was instrumental in formulating Moderna, she was basically, they asked her like, which booster would you get? And she was like, that's like asking, do you prefer Prada versus Gucci? She was like, they're all great. So I think that really is the kind of the bottom line, but we'll see what they end up with. Let's see if I can. See.
So do we have any other questions for Dr. Davis?
There are other questions in the chat.
Yeah, I'm just trying to get to the chat. I don't know where I'm here. Let me see here.
And I know Joni has her hand up to ask a question too.
Okay. Maybe we should do that while I'm trying to navigate my way back to the chat.
Joni, why don't you go and unmute and ask your question?
Oh, okay, thanks. Thank you, Dr. Davis, again for joining us. This is a little bit more of an opinion question for you. So I watched the FDA advisory committee meeting last week regarding the approval of the boosters as well as mixing doses. And while it appeared, it definitely sounded to me like the advisory committee was clear that it made sense to do the boosters in the second dose. They chose not to make any recommendations about mixing doses because they felt like, the safety data was there, but they really felt like there needed to be more long-term data before they can make a recommendation. And they also, from kind of like a regulatory standpoint, felt uncomfortable with the FDA approving mixing of doses under the emergency use authorization. And so I didn't get to watch the meeting regarding the approval today. And so I just wanted to know, was there a discussion regarding that today? And those kind of the concerns that the advisory committee brought up?
Right. So one of the things that's really interesting was that you're right. So I was listening to the part of the FDA part of that, and they just presented the data regarding the mixing and matching, and they really didn't vote on it during the meeting. And then what happened is, like, the next day, they actually the FDA authorized it. I'm unclear how that happens, like, why it wasn't necessary to have a vote, but the FDA actually did say, we feel like it's safe and effective to mix and match. And then the CDC kind of took it from there, and the ACIP part of the CDC, and said, based on the data that went to the FDA, that we agree that it's safe and effective, and that it is, you at least, like, from the data that I saw, they had every arm, it seemed like. So they mixed every single, if you got J&J, then they had an arm for Pfizer, for Moderna, for J&J. And if you got Moderna, they had an arm for each of the three. And everybody did, there was a baseline that everybody did okay. Moderna seemed to be better. And J&J, the big thing was, you really need a second dose. Like, that to me was the take home message from the meetings I saw. And it wasn't that important which second dose you got, like which medicine, which formulation, but you definitely needed one. And other than that, they were kind of like, it's sort of a toss-up. So that was my takeaway. I felt really comfortable with the data saying that it's okay to mix and match from the meetings.
Thank you.
Yeah, it's been interesting to watch those meetings. So does the COVID-19 or vaccine cause blood clots? So COVID-19 causes blood clots. And the Johnson & Johnson vaccine very rarely also causes blood clots. And I appreciate this question, because I think that's one of the primary questions that are used in order to say, does the benefit outweigh the risk? And that same question can be applied for that heart inflammation I was describing as well. Myocarditis and pericarditis is the technical name. Is that the vaccine very rarely can cause these things, and the disease actually causes all these things too. They cause the heart inflammation, they cause the blood clots, and at a much, much higher rate. There's just much, much more virus out there. There's way more infections. And so your chances of getting heart inflammation that is much more serious because you're infected versus the heart inflammation that you get from the vaccine is the benefits of getting the vaccine greatly far outweigh the risks from the vaccine, if that makes sense. And it's the same thing with the blood clots. So yes, you can get blood clots from COVID-19. It is not uncommon at all. You can get blood clots in your brain, your heart, your lungs from COVID-19. And so it is worth to take the small risk. That's why these vaccines were authorized, because it's worth the small risk of, very rare that you may get a blood clot from the vaccine, in order to avoid the much more likelihood that you could get a blood clot from actually getting infected with COVID. I do not know where to apply for an air purifier, but I will say that LA County is having press conference tomorrow at 11. I saw it in YouTube, so that might be a place to check. And maybe following up with your elected officials might be helpful as well. Why is the booster for Moderna half dose? So I don't know if they studied a full dose booster. You know, we always want to do the smallest amount of medicine that's going to give us the best bang for our buck. So that's what they found. They found you only need a half dose. And there are other vaccines where the booster dose is not the same amount as the full dose. So like the Tdap, which is the pertussis vaccine, the whooping cough vaccine that you get when you're pregnant or you're going to be around a new baby, it's not the same dose as when you get it when you're a kid. Does those stats include those of us in trial studies?
So I'll clarify my question. So the stats you had with those of people in Long Beach vaccinated, I entered the Pfizer trial vaccine back in October a year ago. So I was double blinded. I didn't find out. I wasn't unblinded until February. But because I'm in the trial study, I don't know if that data transferred over to your stats, if you guys have received stats from the various clinical trial offices, because they're not doctors' offices. To get my vaccine QR code, it took me 8 weeks from the state.
Wow.
Because they had to verify with the clinical, like I had to fight with the state to get because they couldn't verify my lot doses because they were the exact same, even though they were from October, November of last year.
Right. I don't know. Yeah, that is an excellent question. I remember the conversation around the verification process and the hiccups that it was causing because people were in studies. But I can look into see that, you know, if it's if you're included or if study participants are included in our stats. I hope once they got the QR code situation figured out that you would have been added in, but I can't because that's really where all of that is coming from, is from the stats of who got vaccinated. But I can't, I'll have to double check.
Okay.
But thank you for participating. I think that's everything that I can see.
Did you address the 2 questions that we received ahead of time that I sent you as well? I think you might have. There was something
so.
There was something about replacing the vaccination information. There was a question about vaccination.
Well, I know one question was about testing around the Dominguez channel. Correct. And is Long Beach doing tests? And so no, because this is a county-led response. So it's multiple Los Angeles County departments like Public Works and all these other departments. And so they're really the ones that are leading the response and all the testing and what have you. I know that our city has, I think I put it in there, has written a letter to voice our concerns to federal and state regulators and to, ask for assistance and support. But we're not doing any testing that I know of.
Okay, I found the other question. If we need to replace our vaccination, I'm assuming vaccination card, where can we obtain this information? I guess if they've lost it or
they can get, they can call that 570 info if you were vaccinated in Long Beach, and we may be able to help you. The system that kept all of this data that is from the state is a little bit glitchy, so be patient. We will work with you and we'll try to get everything figured out and get you all, updated and verified and all that. I would strongly recommend, if you haven't already, to make a photocopy of your vaccine card, maybe put it in 2 or 3 places, get the QR code that Ryan's talking about, which is through the state. All of the people who are vaccinated in Long Beach also can get a QR code through Health Vana, so you can call us about that too. We have like a whole flyer on how you can verify your vaccination status, because it is important. Like, I was saying, all those different places where you need to verify your vaccination to get in. Oh, that's nice. Staples will copy your card and laminate for free. That's very nice. So yeah, I would, just to save yourself a headache, I would try to have things in 2 or 3 places. And the state will allow you to add your card to Google Pay. Huh,
Same thing with Apple. They'll allow you to add it to the Apple Wallet.
okay. That's great.
Okay, do we have any other questions?
I do not see any hands up. And there's nothing
Okay.
on Facebook.
Okay. Dr. Davis, we'd like to thank you for your time and thank you for presenting all of this. We really appreciate it. I'm sure that the people in the audience also appreciate it too. So once again, we'd like to thank you and thank you for joining us this evening.
Thank you. Thanks for having me.
No problem. Now at this point of the meeting, what we generally do is we put through some announcements. I know right now over at the Parkway, we will be having a business fair that's being put on by some local businesses for young entrepreneurs. Primary focus is on Black women, as a matter of fact. And it's going to be happening on November 6th. On December 5th, there will also be a Christmas party at the usual place, 167 East South, at the historic Long Beach Dairy and Creamery. We will try and keep ourselves spread out as much as possible. Masks and safety will be required. We do have someone that will be serving you. We will not be handling the food, so we're eliminating as much stuff as possible. And we also have sanitation stations, so that ought to work out good. If we get too big, we'll move next door to the Parkway. So right now,
Actually, Dan, there is one announcement. We got emailed this late, but there is a Long Beach Center for Economic Inclusion. They are doing a protect your community. If you got vaccinated on or after July 20th of this year, you could receive a $50 gift card for your efforts. So the information is here. You can go to the LBCEI Hub at 6509 Gundry Avenue on Mondays and Wednesdays from 8 a.m. to 2 p.m. Or you may text or call Emily Kazim at 562-308-6781 to set up an alternative appointment. And then, of course, there's a QR code here as well that you can scan on your phone to get more information. So there is, I just wanted to share that as well for them.
Okay. Is there anyone else that has anything that they would like, how they would like to address us on any non-agenda items? We are a 501c3. We allow time at every meeting to allow the public to comment on non-agenda items. Each speaker is allowed no more than 3 minutes. Just raise your hand if we do not see any in the next couple of minutes. We will ask for a motion to adjourn. Brian.
Oh yeah, just very quickly, I wanted to highlight a local event coming up. Calvary Chapel of North Long Beach is having their Harvest Fest on the 31st. They're going to be giving out a lot of cool trinkets and prizes, and they're going to have a raffle as well. So encourage everybody to turn out. I'll put the event link on the chat, and yeah, just wanted to give them a shout out. Thank you.
Joshua Hodges.
Hi, everybody. I actually have 2 issues I'm just going to bring up real quick. I'm on Linden Avenue between, I'm right on Linden and Osgood, but between South and Harding, we're having several issues of excessive speeding down our street. And I've been fighting with Public Works, the local councilman's office, Rex Richardson, trying to get something done. I'm just spinning my wheels and I'm not getting anywhere with either stop signs, which probably don't matter because they're running them, or speed humps. And I was wondering if there was anyone that could give me information where I can get started with the speed humps because I'm spinning my wheels. The second issue I have is I have utility boxes on my parkway grass. That's the grass between the sidewalk and the street. Every day I have people urinating on them and once in a while defecating on them. They're owned and operated by Spectrum. Spectrum is not doing anything, and the city couldn't care less about this issue. And because I'm responsible for this parkway grass, I have to clean it up. And I'm getting fed up with it, and I can't get them moved. And I'm wondering if anyone has any opinion on what I can do with these utility boxes. Thank you.
I am not sure if I think Dr. Davis is gone. This becomes there's two things to be able to do this. I'll give you the last answer to the last one first. Try calling vector control for the county. This is a health hazard.
I did try that.
It's not about,
And they don't care.
They don't care, huh?
No, I tried a health hazard. They told me to refer to Spectrum because Spectrum owns and operates them, and the city has nothing to do with it.
Okay.
Yeah, and the police don't want to do anything because they can't catch the guy because when he sees them, he just keeps walking.
Okay. That's Brian. Oh, you mean when they're urinating? Okay.
Yep.
What I was talking about is the defecation. The urinating is a difficult one. But it is a health hazard, et cetera, especially with COVID.
Yep.
Right now, you can transmit several diseases, not only from defecation but through urine.
Yep.
The other one, the speed humps, traditionally in Long Beach, they do not generally do that. You're going to need a traffic study, which I'm sure you've asked and talked about.
Yep.
And tried to get.
I tried to get the study, but with the study, they claim that my neighborhood is not impacted enough for a stop sign. And that's why I said, look, like even with this intersection here, you can't see when you turn because people park in the red anyway. And the one case where someone was doing triple digits and wiped out 7 cars and a light pole on my street, he ran stop signs. So physical barriers is what we need, which is speed humps.
Okay.
And I'm not sure to do about that.
And Reese,
Okay. Hi, Reese. Go ahead.
we
Suggestion?
have two households in North Long Beach, one on 60th, the other one on Osgood, motorcycle riders. There's a couple of Harley 74s and 2 Indians. They're using the pathway of J Mills to South Street to go wherever. And I know you've heard them, but that's a closer location as to where they're at now. My stop sign here doesn't exist anymore.
Okay. That one I will go ahead and get to the council office. I don't know how quickly they can do it, but I will get that one to the council office.
I don't know. I don't know if the homeowners are renters or if they're homeowners.
I don't know if they are or not either. They'll have to do some looking at it. So that's a council office deal. Getting back to the speed humps. Let me give you my phone number, 562-572-1602, and give me a call during normal hours. I mean, this is a little unusual. Give me a call and I'll discuss with you some options. I think Brian, I think I might be able to help you. Darlene.
My question is regarding the redistricting maps. Have we received any information on what transpired last night in regards to those?
I have not gotten any, and I have had trouble getting on today. So I don't know if anybody else has seen them. So
if you're on the redistricting, this is on the redistricting commission's email. I haven't gotten a chance to look at it, but I can forward it to you, Darlene. They sent out an email with the updated maps from last night.
Okay, great.
Mm-hmm.
You can send one to me too, please. Any other questions?
Reese, I make a motion, we adjourn.
Second.
Okay, we stand adjourned.
Thank you, everyone.